So it's May, and this month we're going to be talking about mental health as it relates to disability and chronic illness. So when I was in the planning stages of this campaign for mental health in light of disability and chronic illness, I began to consider not only factors that contribute to my mental health, but factors that contribute to the totality or the majority of our community. Things like inaccessible communication forms. Depending on your chronic illness, things visually need to have some sort of closed captioning aspect, or if you are totally blind or have a severe level of vision impairment, there are going to need to be some auditory cues or some sort of accommodation in that aspect. Another aspect of things that can contribute to one's mental health in a negative capacity is the lack of integrated medical care. When you think of everything from how maybe a medical facility is set up, if you deal with sensory overload, there is a ton of stimuli, but not really any solutions to combat that stimuli for those who are in an urgent care situation. Then you also consider a lot of chronic illnesses have this variability of unknown when it comes to how to treat them, the symptomology, and even how to go about building a support system or a blueprint for effective care. So that can contribute to a stress level, because not only are you educating yourself at home via maybe research articles and journals and whatnot about your own condition, now you have to educate maybe your healthcare provider who doesn't know the first thing about chronic migraine disease, or maybe someone who may be on the spectrum. You just don't know. And so that adds a level of stress and maybe isolation, because now you're in an educating role instead of being in the role of collaborating with your healthcare provider in an effective capacity. This next one is very much so intertwined with the medical system and its lack of integrated care, and that is medication costs. And you can almost group that in with insurance. The battles that one goes through when trying to get medications paid for or insured. Then you're navigating maybe the elimination of certain plans that covered an intervention that might have been effective for you. I know this is very true in the chronic migraine disease community as well as other chronic illness communities. And then when you get into assistive technology for maybe those with disabilities, that's another layer of stress, getting equipment paid for or insured, or finding accessible routes and resources to even obtain certain interventions in certain community and socioeconomic contexts. Another form or another contributing factor to mental health, especially in a negative context, and this is a big one, that's ableism. And in order to understand ableism, we first have to grasp the concept that it is multifaceted. There's structural ableism, there is systemic ableism, there is institutional ableism. There's so many levels to this. And then you get into explicit ableism, where it's this external source of discrimination that you can definitely pinpoint, like a remark or an unwillingness to accommodate under the ADA. But then you also have the sneaky version, which is implicit ableism. Maybe a slight offhand comment or just altogether afterthought, where disabilities and people with chronic illnesses were not even thought of in the structural process of maybe a program or the educational system, whatever it may be. And then lastly, there's another type of ableism, and I've talked about this on my channel before, and that is internalized ableism, which is a byproduct of all those other forms that I just mentioned previously. And it happens when we as people with disabilities or chronic illnesses internalize society's lack of forethought and accommodation for people with disabilities. And we internalize that as us being burdens and being in positions in the spaces and places that we occupy. There are many types or many contributing factors to one's mental health, be it positive or negative, but I can't name all of them in one sitting. But the last one, I feel this can be a very crucial factor, and that is transportation, or the lack of dependable transportation. When you consider that over 70% of disabilities are invisible or non-apparent, as some would say, factor in the fact that there is a lack of consideration in public transportation, i.e. Lyft and Uber, for those with disabilities who might not be able to afford rates at a normal capacity, given being on Social Security income or not even getting or receiving any income at all because they're not able to work. Then you factor in transportation in regard to it being dependable. A lot of public transportation systems in more rural areas fail to meet appropriate standards for getting folks with disabilities and chronic illnesses from point A to point B in a timely manner. So there's also the issue of having dependable public transportation. A lot of times you'll find that larger cities tend to do a better job, but that's because everyone's more closely knit. There's a lot of businesses, there's a lot of infrastructure, whereas rural areas, there's so much land, everything is spread out. So finding a way to navigate that can be difficult and frustrating, and even organizations find it hard at times to meet the needs of those who live in a more rural context. So if you've been on this channel for any period of time, you know I don't like just talking about stuff without acknowledging maybe the repercussions and the ramifications. So considering all the factors that I have named, here's some of the impact that these factors create. It can result in depression, anxiety. Studies show that people who live with disabilities and chronic illnesses suffer or experience depression and anxiety at an astounding rate compared to those without. Then you look at going back to the support system. Are these individuals, or are we surrounded by people who can care for us or just spend time with us, or who have knowledge of our condition, and we have someone we can confide in, because that contributes to isolation and loneliness. Now granted, one can experience loneliness in a crowded room, but for most people with chronic illnesses and disabilities, isolation is not something we choose by choice. So we have to examine that. Another thing that tends to occur is this timidity or this frustration or anxiety towards even asking for accommodations or exercising self-determination or self-advocacy. And this is very crucial because we as people with disabilities and or chronic illnesses cannot afford to not self-advocate. It is a crucial part of living with these conditions and perspectives. My last point will be this. When it comes to invisible disabilities, we must consider that one's mental health is often directly impacting someone's physical symptoms. And that's not to say if you're happy, your pain will go away. So please don't even come at me with that. But that's to say that if our outlook towards the pain and the symptoms and maybe the ways that we have to adapt to society and things around us, if our outlook is negative, if we're dealing with isolation, loneliness, depression, whatever it may be, it often adds to the impact of what we're already experiencing. So it becomes like this cyclical effect that if healthcare providers, family members, and people in our support system aren't aware of, it can often feel very daunting. And it can often lead in a lack of effective care in terms of a medical sense. So recognizing that mental health is a crucial part of treatment, intervention, and just lifestyle when living with a disability or chronic illness, like that is very crucial. And I think recognizing it is the first step to creating change in this area?